health as a global framework. We're just waiting for others to join us, but while we're waiting, why don't we put up a poll on the screen so we can understand better who we're talking with today. While we're getting that up, let me introduce myself. My name is Sonia Kelly. I'm Director of Research at the Center for Financial Inclusion, and I'm going to be moderating the webinar today. You should be seeing a poll on your screen if you just joined us, and we want to know who we're talking with today. So which of these categories best describes you? Are you someone who works in government? Do you work in the private sector? Do you work for a development organization? Do you work for academia or something else? Feel free to make your selection there while we wait for others to join us. Looks like about 2/3 of you have been able to vote. Great, thanks all of you for making your selections here. It looks like about 3/4 of you have been able to vote. Again, my name is Sonia Kelly. I'm Director of Research at the Center for Financial Inclusion, and I'll be moderating this webinar on financial health as a global framework. We've gone ahead and we've put up the results of our first poll here. It looks like many of you are from development organizations, 35%. 25% of you are from others, so we look forward to hearing who you are in our Q&A portion of the webinar today so that we can be sure to tailor our comments to you. And then following those two, private sector, academia, and government. Thanks all of you for joining us. We're going to put up one more poll while we wait for folks to join us. And this poll asks about where the focus of your work is. So which region is the primary focus of your work? I know that these are pretty broad categories, and I apologize for that, but if you could just do the best you can as you answer this question. Select one of the following. Is Africa the primary focus of your work, Asia and the Pacific, Latin America and the Caribbean, North America and Europe, or global? So we want to be sure to be able to tailor our remarks to where you're coming from as best we can. All right, well, let's go ahead and close the poll and see what the results are. Looks like we have a really nice global split. 25% of people are, the focus of their work is in Africa. 41% of people is global, and I'm assuming that includes a lot of the development institutions that focus on all regions based on the last poll we had. We have 14% of you coming whose primary focus is North America and Europe, which is actually a little bit more than many of our other webinars, and I think that's a reflection of the topic today. And 10% from Asia and the Pacific and Latin America and the Caribbean. Great, well, we're going to get started in just a minute, but let me go over a couple housekeeping details. First, we've muted all of you for the presentation portion of this webinar, but we'll call on people individually if you raise your hand. So feel free to raise your hand there in your dashboard on the right side of the screen. There's a little hand icon that you can press, and on our end we can see that you want to talk. If you do that, we'll reach out to you through the chat function and make sure first it wasn't a mistake, but also ask you what your question is and whether it's something that you would feel free to ask on the line using the audio. We're also recording this session, and we will be sharing it on our website afterwards for those who wanted to participate but were unable to do so. And I'll just note one other thing. We've put the brief that we'll be discussing today in the handout section of the webinar platform. So in the control panel there on the right side of your screen, you can see a drop down that says handouts. And there you can see a PDF document that's the full report that we'll be discussing today. Well, let me just introduce myself one more time for those of you who've joined us since the very beginning of the webinar. I'm Sonia Kelly. I'm Director of Research at the Center for Financial Inclusion. This webinar comes at the end of about a year-long project between the Center for Financial Inclusion and the Center for Financial Services Innovation, who is the lead on the project. We had research assistance from the Dalberg Design Impact Group and financial support from the Bill and Melinda Gates Foundation. We're really excited about the results that we're going to be sharing with you today, and we hope that this is the beginning of a wider conversation instead of the end of a project. With this project, we set out to answer 3 questions. First, does financial health work as a framework in developing economies, recognizing that it's a framework that's been applied to high-income economies, but not something that's really been explored in low and middle income economies. I think when we first started out, we were actually skeptical about whether in low income economies especially, financial health was a luxury that people couldn't afford to think about. And we were quickly dissuaded from that perspective. The second question we set out to answer was, if yes, if financial health works as a framework, is there anything that needs to be changed from the way financial health is currently discussed in high-income countries in the application of the framework to low and middle-income countries? And we did find some things that needed to be changed, adjusted, or slightly reframed, and that'll be the focus of much of our conversation today. And the final question was, how can it be measured? That sounds like a very simple question, but I think that's the one that is the still a lingering question mark as we seek to refine some of the questions that we used and refine some of the measurement tools that we had employed in this project. And we hope that that will be a continued focus as we move forward. So let me introduce Sarah Parker from the Center for Financial Services Innovation to give us some context from her vantage point at CFSI. Sarah is a director at CFSI working on their public thought leadership. Sarah is exactly the right person to be on a project that bridges high-income economies looking at financial health in terms of the framework that's been applied there, and looking at low and middle-income economies. She was previously at CGAP and has extensive experience in financial inclusion in emerging markets. I believe Sarah also worked in the Peace Corps and has lived in low and middle-income countries. So welcome, Sarah, and if you could share a bit of context as we start our conversation.
Great, thank you, Sonia. It's great to be here. So I want to just briefly give a context for the financial health work that we've been doing in the U.S. At CFSI. So many of you may not be familiar with the Center for Financial Services Innovation. We're a US-based nonprofit that basically works on financial inclusion issues here in the US. So we're mainly domestic focused, and this was a fun project for us because it was really the first time that we did some work with more of a global perspective. And as Sonia mentioned, given my previous experience, that was a lot of fun for me. So at CFSI, we've been really talking about this concept of financial health for the last few years. And we define financial health as coming about when your daily systems help you build resilience and pursue opportunity. And so those are the 3 components that you see there on the screen of financial health that we focus on: the day-to-day, resilience, and opportunity. And we see this shift in terminology to be a lot more than just semantics. And that's some of the feedback we've sometimes gotten of, is this just a catchy new phrase that you're using, or what's really the value add or the difference here? And we do see it as a lot more than semantics. And I think giving really quickly some of the background of CFSI's work in the US will help show how this is an important concept for us and for our work. So we started our work in the US about 15 years ago. And it was really focusing on the un- and underbanked in the United States, and really trying to get the financial sector to see the un- and underbanked as a customer segment that they should be reaching. And as we did more work, we realized that it was actually better to frame our work as serving the underserved, because we realized, not surprisingly, that a lot of people we cared about were technically banked. They had a bank account, but it didn't really solve their challenges. They were still underserved by the financial system. At the same time that we kind of shifted to that terminology of underserved, there was a lot of push around financial literacy and education. There was financial capability that then came next, as really focused on behavior change. And so these were all really good developments, I think, in how we thought about our work. And a couple of years ago, we found that the financial health framework really helped us to narrow in on the outcomes of our work, really helped us think about what's the ultimate goal that we are working towards in how we interact with the financial industry in helping serve low-income consumers. So an easy way to maybe think about this is financial literacy is what you know. Financial capability what you do, focused on behaviors, and financial health is what you achieve. So just like physical health is something that you never fully arrive at, financial health similarly is a journey, and it's something that you're always striving towards, but it is really the ultimate outcome that we're working to achieve. So in our U.S. work, what we've really been focusing on in the last year or so is how to measure financial health. So this concept of financial health becomes a lot more powerful when you're actually able to measure where someone is at on the journey. So we've taken several steps at CFSI to make this concept more tangible and more useful to both financial providers and directly to consumers as well. So the first thing that we did about 3 years ago was we conducted a nationwide study to measure the financial health of Americans. And we found that 57% of Americans were financially unhealthy. And that's much higher than what the underbanked population would be. So clearly, there are people who are served by the financial sector, but still really struggling financially. Next, we identified 8 key indicators to measure financial health. And that's actually something that we also did in this project, as we'll explain later on, was to identify what are the key indicators, if you really wanted to distill it down, what are the key indicators that a financial provider or a policymaker or even a consumer themselves would use to gauge where they're at in the financial health journey. And so we identified 8 of those key indicators in our US work. And now, based on those 8 indicators, we're developing a financial health score and then testing that score and those indicators with a handful of financial services providers to see what it looks like in practice to actually use these tools to measure the financial health of consumers. So that's just a brief background on our work on financial health in the US to provide some context to this project.
Thanks, Sarah. And now let me introduce Beth Rhine, the Managing Director at the Center for Financial Inclusion at Acxion. Beth works to bring together diverse leaders to address challenges in inclusive finance. It's a mark of, I think, Beth's background and experience and expertise that this project was something that she was really excited about. She's had various positions within Acxion, and most relevant is her work leading Acxion into India and Africa. So she brings both the provider perspective and then also the researcher perspective from her background, her academic background. So Beth, go ahead and tell us a little bit about the data collection efforts, both from your own experience and from Dalberg's nice summaries of the data collection.
Okay, thanks, Sonia. So just to let you know how we arrived at where we are today, we started by consulting a group of experts and tossing around some ideas about financial health. And then Dalberg led some quantitative research, which took place in 4 locations in Kenya and India, 1 rural and 1 urban in each country. We used the results of the qualitative information to develop a quantitative survey that over 1,000 respondents took part in each, total, and the surveys took place in Kenya and India. And then we reconvened the expert group, analyzed the data, and so what you see here that we will just talk about now is the results of that. So the first thing that I think is a super important point, and it's almost goes without saying, but I think we need to stop and recognize, is that the concept of financial health is very much resonates everywhere in the world and at every income level. So when you ask people in Kenya and India to define financial health, they use many of the same words, and they ultimately refer to these same 3 concepts of day-to-day opportunities and resilience. So, but the biggest issue that we have that I think is a methodology issue that sort of permeates the work that we did is the informality of the financial systems of the people that we interviewed. So because most people really operate in the informal sector, and because their use of formal financial services was very limited, that puts us into a realm in which there are no available checkable numbers. So So we're asking questions in a qualitative way, and I think that is just something that's very important to keep in mind as we look at what we found. What we found that we needed to account for in coming up with a framework was a context that was very different from the United States, although in fact there were some interesting flashbacks to the US. So the first thing that we wanted to mention is just that the incomes are very, very, very low, and they're very volatile. And I think this volatility is what we're also seeing volatility rise in the US. So this is something certainly where the idea that your income doesn't come in a regular way, every predictable salary check, is something that's more and more of an issue in the US as it was certainly a dominant issue for the developing world. It means that people who have volatile incomes need sophisticated financial management strategies. We also looked at the issue of whether there's an income threshold, whether when your income is really, really at the absolute poverty level, you have very few, you do use financial strategies, but the ability of your financial strategies to improve your well-being is really limited. The other context, which I already alluded to a little bit, is the informality, but I think the importance there is that you see a very large dependence on financial and social networks. Anyway, networks. Local networks are really the way people build their financial lives. I already mentioned the limited use of formal financial services, but there was quite a bit of use of more informal financial services. Much of that just has to do with payments back and forth among family, friends, employers, but it also has to do with everybody was very familiar with, and many people used the informal societies like the Chamas in Kenya and the Bishis in India. So accounting for those real changes in the context between what we saw in the US and what we saw in Kenya and India, we nevertheless saw 4 behaviors that really shaped the way people ran their financial lives and helped to determine whether or not they were financially healthy. So we call this shaping income and expenses, building reserves, cultivating receivables, and planning and prioritization. So let me just go into each of those very briefly. Shaping income is a question of dealing with the fact that your income is low, but also dealing with the fact that it's not coming in. For example, if you're a farmer and your income is highly seasonal. There were issues about whether people would diversify their income versus pursue a growth strategy in a single business. There was the question of how to maximize labor income, and the amount of labor performed is somewhat variable. So the shaping income really is a place where financial strategies and economic strategies are hard to separate because people are using actual economic strategies to try to even out their income so that their consumption can be more even. And here are some of the ways that people do that shaping of income and expenses. The shaping of income is often an economic strategy. The shaping of expenses is more likely to be a financial type strategy where people are earmarking money for specific usage or keeping better track of how they're doing. The second big important behavior is building reserves. And so building reserves in this context can mean both in-kind reserves, and certainly we saw a lot of people I went to rural India and we talked with people whose main wealth was in the form of goats, and they certainly knew exactly how many goats they had. And we also see that in India, particularly, people save in the form of gold. But they also do save in money form. And the ability to do this is certainly an important building block of financial health. And this woman is an example of somebody who really used a strategy of building reserves to an extreme. She saved for 10 years, bit by bit, to acquire the money to be able to buy a stall and begin selling at a little Kirana shop. The next strategy, cultivating receivables. We struggled with what to call this strategy, but this strategy captures the very important strategy of building up the ability to call on resources when you need them. And we could put buying an insurance policy in the category of cultivating receivables in some ways. But without insurance, people are cultivating receivables more informally. They're developing informal, they're participating in bichis and chamas, they're just developing social relationships and participating in reciprocal exchanges. Often these are not necessarily seen as financial. They may be doing a favor for somebody. But one of the common themes is building, and I think that relates back to the US, is building a good history as a creditor, as a borrower, is part of cultivating receivables. Whoops, one is missing. The last one, the one that's missing, is planning and prioritization. And we saw, I'll go back so you can't see it. With planning and prioritization, we see that people use different strategies, and one of the things that really popped out as a marker of financial health was the ability to plan over a longer term. So some people were their horizon for planning their financial lives was just a few weeks. Others were able to plan for a couple of months or longer than 6 months. We really saw a high correlation between people's satisfaction with their financial health and their ability to plan long term. So that is a very, very brief summary of extremely rich information that we found out about how people make their financial decisions and run their financial lives.
Thanks, Beth. And we've already gotten some questions coming in about a lot of what you shared, because that was a very broad overview. And I'm hoping that we get a little bit deeper into some of these topics. I know that you wanted to. I could sort of feel you wanting to go deeper.
You took my slides away.
All right, but taking all of that research, Sarah, could you tell us a little bit about the framework that emerged as a result?
Yeah, definitely. So from all of that rich research, and actually in the report, there is a link to a deck with a lot of the insights that came from Dalberg's Design Impact Group's research in India and Kenya. So if you want to dig deeper into that, that's there. But what we did from all of the insights, both from the quantitative and qualitative research, that we did was to try and distill it down into what you see here, which is a framework of the financial health indicators for the developing world context. And you can see there are 6 indicators there that would indicate whether an individual is financially healthy. And let me just briefly go through those 6. So the first one is balancing income and expenses, and this describes an individual's day-to-day financial management, both short and long-term needs. So this is really at a basic level, do the income and expenses coming in and out of the house, and how well does someone manage that day-to-day financial activities in their household, or for them as an individual, whatever it may be. The second one is building and maintaining reserves, and you can see how a lot of this just flows directly from what Beth just described as the key insights coming out of the research. And here we use the word reserves instead of savings, because we recognize that reserves, or that concept of saving or storing is much more nuanced in these markets. It's not just how much money you have in a savings account the way it would be in the US. It's much more diverse. There's a lot of economic value in various types of forms of cash, in-kind assets. So this indicator captures the behavior of intentionally or habitually putting away assets, as well as the magnitude of the assets that are available. So not just what you are continually putting away, but also what do you have put away to draw on when the time comes that you need to use that. The third indicator is managing existing debts and having access to potential resources. So again, this is really looking at an individual's existing debt obligations and to see if those debt obligations are sustainable and managing those debt obligations well. And then also the potential to call on external sources for additional resources when the need arises. So that's really someone's access to credit, whether formal or informal. And this is kind of a corollary to what we saw in the US. Clearly, this is a concept that exists everywhere, but in the US, the indicator that measured this concept was a credit score, because in the US, or in other developed economies, a credit score is really it shows whether they're managing their existing debt well, and then also if you have a higher credit score, you're going to be able to access more credit when necessary. That obviously doesn't correlate in many of these countries, but the idea still is pertinent, which is how are people managing their existing debt, and do they have the ability to call on resources when necessary. The fourth indicator is planning and prioritizing, and this is similar to what Beth was just describing. This is lots of different factors here. So the time horizon for planning, how far out are people planning? Are they just planning for tomorrow, or are they able to plan for next month or even further out? What are the types of goals that people are focused on? What are the action steps to achieve those goals? What action steps are they taking? And then also even things like confidence in someone's financial future. How confident do they feel? That really does translate into the way that they plan and the way that they prioritize so many different demands on their time and on their money. The fifth indicator here is managing and recovering from financial shocks. So, one theme that just came through so clearly in the research was that everyone is preparing for or recovering from some kind of financial shock, something that happened that was maybe very unexpected or maybe not so unexpected, but they're kind of hoping that something doesn't happen that kind of pushes them off balance. So this idea of financial shocks was really clear in the research, and it was really important, I think, to capture here. And this is really just looking at assessing how well equipped someone is to manage these shocks and to recover from them. So, this is really looking at when an emergency comes up, are they able to manage that? And then are they able to quickly recover? And then the last indicator is the use of an effective range of financial tools. And this is also something that came very clear from the research that we've seen in lots of other research as well, but these respondents used a whole suite of financial tools, and both formal and informal. They really had a lot of tools at their fingertips, and those that really used a range of those tools and use them effectively, we saw to be somewhat more financially healthy. So this indicator assesses how well an individual can access those tools within their markets and then use them to acquire, move, store funds, grow their assets. So how well are they at managing all of the different tools that they might have at their disposal? So those are the 6 main indicators of financial health in a developing world context. And let me then present 4 key factors in understanding global financial health. And this is kind of the second part of the overall framework that came out of this research. So what we saw in the research was that there were several external factors that significantly impacted financial health in the context of the developing world. They really aren't indicators in and of themselves, meaning that they would be key things to measure when seeing how someone's doing financially, but it's important enough to look at in order to understand the context in which someone is living out their financial life. And again, many of these things are things that came through in what Beth was mentioning from the research. So the first one is absolute income level. So again, this is really just around the idea that respondents who are living in deep poverty have really limited bandwidth for striving towards greater financial health, because their focus is really on daily survival and not so much on longer term aspirations. So in this research, and similar to the research that we've done in the US, we absolutely see a correlation between income and financial health, not surprisingly. But in the US, we saw that actually there were factors like planning ahead and like savings that were actually more closely correlated to financial health and income. And I think in these markets, in the research we did in Kenya and India, we saw that really there is kind of an income threshold, so to speak, below which it's really just about bringing more money into the household, and that's really what intervention is needed. But we still think that financial health can be measured for those individuals. It's just really important to take into account their income level. The second contextual factor is income and expense volatility. And so, not surprisingly, again, this has come through in lots of other research that has been done. There's just a lot of volatility both on the inflows of income and the outflows of expenses. This comes about in terms of the variations, the amounts of money that comes in, the timing, the predictability of it. And again, volatility alone does not lead to poor financial health, but it can make it difficult to manage, and it can make it difficult to plan. And so it's important enough of a contextual factor that we wanted to call it out, because it would take more effort on the part of the individual or household to really manage that volatility. Again, we saw volatility, and we see that in US households as well. In US financial diaries that have been done, we've seen the volatility. But I think the extent of that volatility and the prevalence of that volatility in the households of these of the respondents that we researched in India and Kenya really made it so important that we had to call it out as a contextual factor. A third one is social networks, and this is also just very evident the importance that social networks play in terms of having a range of family and friends and community contacts that are available for some kind of informal financial arrangements. So the consumers in our surveys relied most of their social networks to respond to unexpected expenses. So they turn to their networks for unexpected expenses like illness in the family, maybe a crop failure, and they leaned less on their social networks for more predictable expenses like school fees. But still, we saw the importance of these social networks and how integral they really were to someone's financial health. And then the fourth factor is the financial role. And this is really, what's the status within the household that someone plays? So are they a dependent? Are they a contributor? Are they a key financial decision maker? And this really is important to give a context for how much agency someone has over their own financial health. So in our research, we interviewed members of multi-generational households in rural India. And this was where there was one lead decision maker in households that contained several adults. And so the members of the family had really varying degrees of control over their household's financial behavior and decision making, and ultimately the outcomes. And so that's important to keep in mind in terms of who you're talking with. I think this context is helpful to really understand how much agency an individual has over their financial health. So between the 6 indicators on the previous slide and then these 4 key factors, that's really the framework that came out of the research that Beth was discussing in trying to begin to understand what does financial health look like in a developing world context, and how would we begin to measure that.
Thanks, Sarah. And then if I could just add a couple more things before we turn to our discussion. The first was that as part of this research process, we didn't want to just develop a framework for financial health and have it sitting out there in space with nobody to actively use it. And so we engaged stakeholders from a lot of different areas, but I just want to highlight 3 different use cases that we heard and that also we think would be relevant. The first is researchers. We've gotten some questions coming in from some of you that make it clear that you already have research minds. Some questions on how this can be combined into a more formal model, questions on what the impact of some of the different elements of the framework are versus others, like is it balancing income and expenses that really makes the difference in somebody's financial health, or is it something else that is the key that unlocks somebody's financial health? So it's clear that there's some interest from the research community in using this framework or ideas that come from this framework. The second is providers. In the US, CFSI is doing some really interesting work engaging providers of financial services in trying to actively measure the financial health of their customers and seeing how that financial health improves over time, hopefully with the use of their products. There's also something to be said for providers just sort of knowing more about their customers and being able to pinpoint, what sorts of products they would need to improve their financial health. Financial health can be a key performance indicator for providers of financial health, and the ecosystem around providers, like the investors and social performance working groups or networks of providers, can be helpful in trying to incentivize those things. And finally, policymakers. The financial health framework, we've heard from others, is of interest to policymakers to better understand where their populations are. This is something that has been of interest in the US through some of the great work happening in the government with the CFPB and others, to better understand some of the pain points of consumers in their markets, and therefore how to better improve the financial health of their populations. I'll just mention one more that I actually forgot to put on the slide, and that is employers. When we were thinking who is best poised to have an interest in and improve the financial health of people, we started thinking about the employers that pay them, and thinking about a workforce. And if a workforce is financially unhealthy, they might be unfocused at work or have significant stresses that could affect their job performance. And we've heard anecdotes from some of the folks that we talked to along the way in this process about employers actually having working groups within their staff, or groups that come together to talk about how to actively improve their financial health, and employers wanting to be involved in that process. Certainly in the US, the push to save for retirement has been a significant focus of HR departments, and that is an aspect of financial health, preparing for one's financial future. And we see other applications of this framework along those lines.
And then, if I could just add one more use case, is for people themselves to measure their own financial health. And we see that as ultimately that measurement of one's own financial health is an important financial capability tool.
Yeah, absolutely. And then in thinking about the next steps for this particular project, we had a great time over the past year. I think this was one of my favorite projects that I've ever worked on in my career. Being able to create a framework and sort of define what financial health is in an emerging market context, and test different indicators. It was really fun. But now we're at this stage where we have to strengthen it through more measurement. Testing it with a small sample in India and in Kenya as sort of a pilot is one thing, but it's clear that there's more research needed to continue to improve the strength of the framework, the indicators, and especially how to measure it. And so as a researcher, that's sort of where my mind is going. Hopefully we can talk a little bit more about what that means in the context of our discussion. And then finally, we have these use cases that I just talked about, but there's also the need to move this framework to active use. And so we have some theoretical use cases. We have some great examples of people here and there, anecdotes about people using financial health as an organizing concept for their work in emerging markets, but those examples are few and far between, and we'd love to see additional interest in using this framework. Anything else to add, Beth and Sarah, before we move to the discussion? Great. Well, I'm going to turn first to Ezgi Unkaner. I'm so sorry. I likely mispronounced your name, but we're going to turn you off mute. And Ezgi, you had a great question on resilience and wanting to go a little bit deeper on that topic within the framework itself. Ezgi, can you hear us? Or rather, can we hear you? Is your mic?
Yes, I can hear you very well.
Great, we can hear you. Go ahead and ask your question.
Great. During Beth's presentation, I was curious about whether there was any difference between the resilience in the US and the markets in Kenya and India, because of perhaps due to the social security nets or other safety nets which are available in the US sometimes but not elsewhere. So that's my question. Thank you.
Yeah, clearly we didn't do a direct comparison back and forth between the U.S. and Kenya and India, but certainly there is less of a safety net in terms of what government provides, in terms of insurance being available, and so maybe to compensate, we see people devoting much more of their focus to their genuinely social safety net in terms of their relationships.
Thanks. Sarah, anything to add?
I think that's a good summary. I mean, I think we did see in the US, we see that among lower income populations, a higher prevalence of reliance upon social safety nets. And then as people kind of move up the income spectrum, they rely on that less. And I think within our team, as we were discussing these concepts in an emerging market context, we were wondering, you know, how should we frame the use of safety nets? Is it something that we want people to, you know, quote unquote, graduate from as they need to rely on that less? And ultimately, we didn't make any kind of subjective decision about that. I mean, it was really, it's a factor that's important to take into account, and it's part of the culture. And so, you know, the existence of those safety nets is really more of what we want to measure rather than maybe some of the qualitative nuance around how it's being used. But yeah, I would say that the social safety nets are just much more important when it comes to resilience.
Great. Let's turn now to Thomas Dwyer. Thomas had a great question about financial advice and how that changes financial health. I don't know that we have an exact answer for your question, but I think there are some interesting observations that came out of the research in terms of where financial advice came from, whether it was from informal sources or from financial institutions. Thomas, are you on the line?
Yes, I am.
Great, we can hear you. Go ahead and ask your question.
Yes, I was curious on the model in that my company, I'm actually working with the Financial Planning Standards Board, which is based in Colorado. So we're actually growing and deepening the financial planning industry globally in the developing markets, and doing that through kind of building a cadre of qualified financial planners through the CFP model. So I was kind of curious, you know, they don't have much research as to whether or not, you know, people's financial health is more improved when they have financial advice versus when they do, and then where that advice would come from. So we're looking to deepen this much more in East Africa and across the continent and in Asia and Latin America as well.
Yeah, that's a really interesting question. We did ask people where they learned about, you know, where did they acquire their family, their strategies from, and basically people didn't. Most people said it was just themselves. In India, we could see a very, very strong role of tradition, and that, you know, people would say, this is the way my father did it, and so this is the way I'm doing it. but a tradition of sort of seeking mentors or people who give advice other than within the family, or simply not asking anyone for advice, seems to be the norm. So while I'm sure a lot of people would benefit from having financial advice, I think developing a culture where people know that they could seek it is a big undertaking. Good luck with it. And I mean, I certainly support doing it. So I didn't mean that sarcastically.
Yeah, I think that question of where advice comes from is a really interesting one. We saw some significant differences on that front in the India versus the Kenya research. In India, as Beth said, it was more tradition. In Kenya, people seem to be more open to testing and trying new things and having lots of different strategies they were employing to see which one worked best. And that was really fascinating to see. What does it look like in the US context, Sarah?
I think the industry of financial advice and coaching is just much more built out and, not uncommon for people to use. That said, I think much of the way any of us manage our money comes down from the way we saw it within our household. So, that is, I think, still a very common strategy, and it's something that just kind of is coming from what you observe or what you learn within the household. And for some people that may mean nothing. They learn very little from their parents or from others in their household, and they might be more proactive to try and seek some of that counsel within the financial industry itself. So I think the main difference would just be the sophistication of the financial advisory industry in the US.
Yeah. Well, let's turn to some questions about measurement. I'd like to unmute Bobby Gray, who had a question about the status of the member of the household and how that made a difference in financial health. Bobby?
Sure, it was probably as much just of a clarification, because as you were giving the example about India and talking to several of the members, I was just curious, like when you actually did the studies, were you asking questions of a person about, these things as it relates to their entire household, or at least what they know, or did you interview more than one person? It sounded like in some cases you interviewed more than one person. So that's kind of question number one. And then I was just kind of curious to hear you talk just a little bit more about the types of questions maybe that you asked about the roles that people play in financial management.
Well, so there was a big difference between the qualitative and the quantitative research. In the qualitative research, we were frequently talking to a family group. And in those, we would observe that the answers were mostly provided by sort of the lead family, the head of household, or the lead financial person in the family, although other people would chime in and augment. But that kind of dynamic that took place in the qualitative research really illustrated how people didn't have the same ability to shape their own financial lives. And then in the quantitative research, it was individual, and that is really from a methodology perspective. It seemed necessary, but it's clear that people are frequently answering from the perspective of their household as a whole.
Right. And did you have both men and women with the quantitative, and were you able to see any differences in the way they answered those questions? Like just questions.
We did have both men and women. I don't think we have done that analysis. It's a very rich data set that I think we could continue to analyze.
Yeah, just one observation from digging into the data. There were some differences in men versus women respondents. Women were more likely, or were less likely to be satisfied with their current financial lives than men were. Women were also less likely to say that they sort of felt in control of their financial lives, which, those findings should not really be surprising. But those are the kinds of things that we, would like to dig into some of the data we have and collect more data on, so that we can make better observations about that.
Right. So in your question, just one more, in your questions, did you ask things such as whether like breaking out different types of financial decisions and whether they have, you know, they make those decisions jointly or by themselves, like whether you said, you know, do you who has the final say about use of income, savings, taking credit? Did you ask those types of questions just out of curiosity in the surveys?
No, that really wasn't a focus of the work.
Okay.
Yeah, we didn't get that. We didn't get that granular. We asked, are you the primary financial decision maker in your household, sort of generally, but I mean, obviously there are a lot of, there's a lot of gray area there. You know, somebody could be a primary decision maker about things that happen to the children, but not, you know, things that are on the business, or, you know, those kinds of things. So
one of the things that we did, I mean, the qualitative research really did shed a lot of light on the household dynamics. And one of the things that was very interesting in India was the extent to which you had multi-generational families that involved essentially a patriarch with sons and their children. And so the sons didn't gain full autonomy financially until the patriarch moved on. And so rather than thinking of a nuclear family as the unit where you worry about the dynamics between husband and wife, we saw that in many families it was more complex than that, and fewer people actually were completely in control of their finances.
Great, thank you.
Well, let's turn now to another question on measurement. I'd like to unmute Monique Cohen, who had a question on resilience and measuring resilience given to shocks, especially given some of the research on financial shocks and how they affect people's financial lives. Monique?
Yes, I want to congratulate you on recognizing the importance of managing shocks and recovering from shocks, because shocks that tend to keep people really poor, they build up assets and then they lose them because they confront a shock. So what are the main shocks you identified, and how did you measure them? I mean, how did you go about measuring the impact of this indicator?
Well, the single biggest type of shock was health-related shocks, but we asked about a much wider range of shocks, including like economic failure for one reason or another, like crop failure, disasters, theft, but one of the things that was interesting was just how, again, a difference between Kenya and India. Indians in our sample were much less willing to admit that they had suffered shocks. When we compared the illness rates between Kenya and India, it looked like Indians never got sick. And so I think there's a huge methodology issue there in asking people about shocks in a way that will elicit answers that are not, you know, biased in some way. We also looked at debt management. This is a little sort of a side issue, but Indians were generally saying that they didn't have much debt, and then when we asked them whether their debt stress was manageable or not, the very high proportion said that they had very heavy debt stress. So anyway, there were some contradictions there.
Yeah, I would just add that I think in terms of how do you measure the resilience of people recovering from, or at least managing shocks, you know, we did ask some questions that got to that. I think something important to keep in mind is the link between savings and credit being used to manage shocks. So I think sometimes we think it's, you know, when we see savings levels in whatever way we measure that, reserves go down, we think that's a bad thing. But actually, if it's being used to recover from a shock, that's a really good thing. The fact is that they have put money away into some kind of reserve just for this reason. And the fact that they can then draw on that reserve is fantastic, because maybe that means they won't have to take out some type of credit that would be unsustainable for them. Or if they are are able to access credit and they have been able to manage their existing debts and they have access to those resources, then again, that's a good thing that they're able to manage their shocks and recover from them in a way that's sustainable. So just kind of pulling down, seeing kind of reserves decrease isn't necessarily a bad thing if it means that they're able to recover from shocks in a more sustainable way. That doesn't kind of draw them back into deeper poverty or a more financial unhealth.
Thanks for that discussion. I'd like to turn now to Selena Lee. Selena had a question about the framework, and in looking at it said, you know, some of these things look like financial capability. And I think that's a really interesting question given the evolution of these conversations in our industry. Selena? Selena, are you there? Oh, looks like we can't get her on audio, but let's go ahead and answer that question. You know, she looked at these 6 indicators and said, you know, some of these kind of look like measuring financial capability. How is this different from a measure of financial capability, and what does that look like in terms of the conversations in our industry?
Yeah, that's a really good question. I'll take a first stab at that. So yeah, so if you think of financial capability as mainly around behavior, and you look at these 6 indicators, they all are behaviors. Ideally, the indicators would be pure outcomes. It would really be the outcome of, let's say, managing and recovering from shocks, or using, or, you know, building reserves and that kind of thing. I think the challenge, and if you look at the 8 indicators that we developed for the US context, it's a more balanced mix of both behaviors and pure outcomes. You know, it's an outcome of actually having a prime credit score. It's an outcome of having appropriate insurance products. It's really not the behavior, it's really the ultimate outcome. The challenge here is what we've talked about, which is, given the informality of financial services, it's very difficult to measure those outcomes. It's hard to really say what are people's absolute savings levels and reserves that can be drawn upon in the case of a shock. That is really hard to measure, just given all of the complexity of people's financial lives, the informality of financial lives, the lack of data that a financial provider might have about their customers, the actual nuanced and detailed information that an individual might have themselves about their financial situation that we might be looking for. So I think we had to default to many of the behaviors to try and be proxies for some of those outcomes. And I think as we continue to develop this framework and do additional research, like Sonia was mentioning, and lots of other things we'd like to do to beef this up, the goal would be to try and move as much as possible from behaviors to, again, those ultimate outcomes, given all of the measurement constraints that we have.
Thanks, Sarah. Well, let me just make a final observation as we begin to close our hour. For me, having worked in this industry for about a decade, I think this is a really important work, in part because it helps us define why we're doing financial inclusion. You know, I think we started looking at financial inclusion as an end in itself, and that's a temptation to say, with better financial services, people are going to have better lives, and that might not be the case. And it's certainly something we want to test. And so for me, thinking about financial health as an organizing framework for the value proposition of this financial inclusion industry that has built up over the last few decades, I think is a really important value add to our industry. And that's something that I'm going to keep in mind as we move forward. Any final observations along those lines, or others, Beth or Sarah? Great. All right. Well, you can download the report and see those slides that Sarah mentioned on our website. We've put a link up on the webinar. You can also still download it from the handout section of the webinar platform. There are a number of you that asked questions that we weren't able to get to, and we'll follow up later by email, Beth, Sarah, and I, to make sure that we can finish those conversations that you started. And certainly, again, like I said at the beginning, we don't want this to be the end of a project, but rather the beginning of a conversation. And that's the attitude we'll be taking as we move forward. Thanks everyone for joining us. Have a great day or a great evening wherever you are, and looking forward to following up with all of you afterwards. Thanks.